या देवी सर्वभूतेषु शक्तिरूपेण संस्थितान् नमस्तस्यै 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 नमो नमः. Hello friends, I'm here again to have some talk on the herbs from the kitchen or some herbal medicines which can be given to the infants or children. In the time of total lockdown and curfew-like position, nobody is like to go outside the home, or whenever if the child falls ill, it is very difficult to take him to the doctor for medicine or for consultation. In those circumstances, I would like to give you some tips about the herbs or spices which are available in our kitchen. First of all, I will make you aware of the few herbs which are available in almost every kitchen. Number one, this is aniseed, means soap. Then there is carom seed. This is ajwain. Then this is black cardamom, big cardamom, which is called moti ilaichi, and it is one of the ingredient of garam masala in our kitchens. These are the nutmegs, means jayafal. It is also used in a kitchen by Indians, mostly in all the garam masalas. Then there is large dried grape. This is called munakka. Then this is licorice, means mulethi. These are the herbs which are available in every kitchen, and these are the leaves of holy tulsi. Tulsi, everybody is aware, or it is called basil also. Now I will tell you different recipes or different ways how to use them for the treatment of the infants or the child. Infants means the child is below 1 year of age, and below 3 months the child is not given water. It is clear instructions of the doctors. So if the child is taking a milk formula or every milk formula or milk in powder form is given to the child, then what you have to do, you take 3 grams aniseed, 3 grams carom seed, then 1 cardamom, black cardamom, 1 piece of this mulethi, means licorice, and 2 leaves of holy tulsi, and 1 piece of this dry grape. Boil it in 1.5 liter of water. Boil it for 10 minutes so that the decoction of it, these herbs come out. And this should be given in this formula or powder form milk every time milk is to be made in that water. If the child is being given pasteurized milk, just like DMS, Mother Dairy or Amul's, then what you have to do, you take the similar quantity of the herbs, boil it in half liter of water. When it remains about 150 of ml, then you give this water 4 spoon water in every milk, every time milk. 4 or 5 or 6 times a day you are giving the child a milk, because the child is totally dependent on the milk. Then it can be given in milk also. If the child is able to take it in the decoction form, then by adding some sugar candy, mishri, or honey, the child can be given 3 to 4 spoon water in 3 times a day. This is for chest congestion. If there is wheezing, cough, cold, and there is sneezing, or there is wheezing in lungs, then this can be given. For application, you can take 2 spoon of this desi ghee, means clarified butter. Add half spoon of brandy if it is available. If it is not available, then add 10 drops of amritdhara. If that is also not available, then you take 2 spoon desi ghee, add some seeds of about half spoon of carom seed, and about 1 to 2 gram camphor. Camphor mostly is available for puja, etc. You have to boil this butter, or pure clarified butter, by adding both the things, and then rinse it and apply on the, keep it in a glass ware, then apply on the chest and the back of the child. It will give lot of improvement, or in wheezing, or there is if he is making a sound from the chest. Similarly, if at the same time the child is having only cough, and every time he is not able to take the milk but he is coughing, the child is not able to cough out. So what you have to do, you have to boil this tulsi patra, means holy tulsi, few seeds of aniseed, and then 1 piece of mulathi. And this water should be given to the child, or when you are putting in milk water, then there is no need to do this separately. But if you have to do this separately, then 3 things should be boiled and given to the child. Child will get 1 or 2 poop, and all the mucus and cough will be passed away in the poop, and the child will get a relief. This medicine, or this decoction should be continued at least 8 to 10 days, so that his system of digestion and all that becomes clear. And if the child is having loose motions or diarrhea, then you have to take 1 nutmeg, means nutmeg, and crush it to the fine powder. Take a pinch of, only pinch of this powder, and add with a spoon of milk, or with, if you can give it with honey, 4 to 5 drops honey, and this nutmeg powder should be given to the child, and it will immediately give relief to the patient or to the child in diarrhea. If there is vomiting, then you have to take few leaves of mint. Mint leaves that should be boiled, and added some sugar candy, means mishri, in it, and boil it and give to the child. Or simply you can give vitamin D, glucon D can be given to the child, and it will immediately stop the vomitings of the child. These are the few things I have told you, and believe me that these things are pre-tested, or these are being used by our dadis or grandmothers for centuries, and it can give lot of relief to the child. and can save your child from all these disasters. All it is pertinent to mention here that all these herbs contain antifungal, antibacterial, antioxidants, and they are useful in digestion of the patient or inducing sleep. All this nutmeg is useful for inducing sleep, and these other things are useful for this stomach distension, etc. If there is a pain and colic in the stomach of the patient, you can also apply hing, is aspodia. You take a pinch of hing, and in spoon put 4 to 5 drops of water and mix it and apply on the stomach, means this solar plexus portion of the child. He will get immediately relief. The gas will be passed away and the child will get relief. This is all I told you, and I will request you that these are the things which are used in every kitchen, in Hindu families and in Indian families. If your child is in distress, you please make use of these things and get your child free from all the pains and worries. Thank you very much for listening my